Hi, this is Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida College of Public Health, and I want to take a few minutes today to revisit this topic of COVID-19 deaths based on the date that they're reported versus COVID-19 deaths based on the date that they occurred. And you can see that again down at the bottom because I've actually put out a number of videos on this very topic throughout the pandemic. But there was a recent snafu with the CDC's reporting of Florida numbers in terms of new cases and new deaths, and it resulted in the Florida Department of Health updating the entire time series of data for cases and deaths, and they really ended up transitioning from those two events, cases and deaths, from date reported to dates that the events actually occurred, which in my opinion is an improvement in the numbers. But unfortunately, that's led to some accusations, like always, that the Florida Department of Health is somehow being nefarious or trying to hide something. So I just want to briefly unpackage this, talk about the differences between the two, and hopefully fill everybody in on an important topic. So, this is a figure from an article in the South Florida Sun Sentinel that basically was just comparing in Florida since the beginning of the calendar year two different curves for COVID-19 deaths. The one that's here in a tealish color is COVID-19 deaths based on the date that they are reported, and the red line is COVID-19 deaths based on the date that they actually occurred. And so you basically, the big focus was what do you see at the end of these two curves? The deaths based on date reported is going up at the end, and the transition to deaths based on when they occurred has this, what you're going to find is a very characteristic downturn in the last 2 weeks or so. And so I was actually quoted in this article, and I basically said if you look at deaths based on when they occurred, it is the most accurate. There's no doubt about that. But we'll always underestimate recent deaths because of reporting lags. And so I'm hoping that by the end of this video, it will be very clear as to why that happens. To me, when I saw this, I immediately thought of it as a gift. I've been waiting since the Florida Department of Health transitioned their reporting, the breadth of it, the frequency of it. We used to get a data set that was deaths based on when each death occurred. And since then, we've only had deaths based on when they are reported, which has some limitations. And so, even though I viewed this as a gift, other people, of course, with a very scrutinous eye, said that there must be something going on. They must be trying to make the pandemic look better than it actually is, which, in my opinion, either demonstrates that you really don't know what you're talking about or you're being a bit disingenuous. Because if you don't know what you're talking about with COVID-19 deaths, you know that we can absolutely now look at deaths based on when they were reported or when they actually occurred. Nothing is being hidden. We just got more information that we did not have. And so let's talk about this. First, the deaths based on when they are reported, this teal line. So the first thing is we can absolutely, even though what's reported to the CDC now is deaths based on when they occurred, we can absolutely still get the deaths based on when they're reported. The Florida Department of Health puts out this weekly report. We can do a simple job of subtracting cumulative numbers of deaths. On this report, it was 40,766 resident deaths that had died to date. And so we can just compare this to other reports. And in fact, this is exactly what I do on my dashboard. And so even though there's been a transition to reporting, again, we're getting the best of both worlds because I can still construct a curve based on deaths when they are reported. And we can see that uptick, the fact that we are now seeing more and more deaths being reported on a weekly basis. The big challenge with a curve like this is when somebody reports 1,071 deaths that we learned about in the most recent week. What does that mean? When did these deaths actually occur? That's what we really don't know. Well, if we look at the Florida Department of Health's weekly report, we do know how many of these 1,071 occurred in the most recent week. That's 286. They actually give that number. But that means the other 785, we know that they occurred prior to the week covered in this report, but we don't know exactly. Did a lot of them happen in this red box just in the most recent 2 weeks? Did a lot of them actually happen a month ago and are really more reflective of something that's already long since passed and not the most recent trends? So we know that there is a reporting lag in deaths. That is, after a person dies, it takes time for the death certificate to be certified, for that information to end up with the Florida Department of Health, and the death actually be reported. And that lag can be substantial. I would say it's typically maybe 1 to 3 weeks, but it can be 5, 6, 7, 8 weeks in some cases. And so, again, that's the big limitation. Although we can clearly see we are learning about more and more deaths each week, and we can speculate that deaths more recently have definitely been going up. When we see this, we really don't know the majority of these 1,071 exactly when did they occur. What is this really telling us about recent history? And so now I want to focus on the goal of this video, which is the red line. This is what the Florida Department of Health and their reporting to the CDC has transitioned to. I love this curve because it is a more accurate curve, but you are always going to see this characteristic downturn at the end. And that's what I wanted to take a little bit of time to explain. So what I did is I simulated some data from May 1st until July 31st. So 3 months of death data on COVID-19. And so here are just some basic assumptions I made. I made the assumption that on average, about 23% of all deaths that occur will actually be reported within 2 days. That's great. That's a quick turnaround. 70% of all deaths that occur will be reported within 1 week, and 97% of all deaths that occur will be reported within 2 weeks. This is just the assumptions I made for simulating these data. I would say it's actually probably a little bit better in terms of the lag. The lag is less in my simulated data than what might actually be occurring, but we'll be a little optimistic. It'll still demonstrate the point at hand. And so the big thing in this case is we're going to know the truth. This black line is showing you exactly how many people ultimately ended up dying on each of these days in this 3-month window. So again, we often don't know the truth. That's part of the challenge. But in this simulation, we know the truth. And this is the daily numbers. The ebb and flow is in the black line. And clearly what you see is basically up until the end of June. So for the first 2 months, there wasn't much going on with COVID-19 deaths. The trend was no trend, right? It was staying pretty constant at about 32 deaths on average. Then we start to see an uptick, and we see a continued increase after that, all the way until we're starting to get into the 80s and 90s in terms of deaths. So again, we're going to assume that this is the true underlying trend, but we're also going to know that we're at the mercy of when these deaths are reported. And so that's what this next animation is going to demonstrate for you. So I'm going to play this animation that I created. And what you're going to find is we're going to see how this information fills in. Again, we know the truth. That's the black line that's faded right now. And we're going to see as each day, you're going to see this line move from left to right. That's going to be each day how many deaths are reported. How close are we getting to the truth as the reporting comes in? So let's go ahead and play this. And again, what you're going to learn is as the line hits a certain day, there's still a big chunk. So basically, as you move to the left of this dotted line, you see that there's a lot left to be known. And you can see that this red is basically what's reported. This would be a deaths by date of death curve. See how it's always bending down at the end? And as we get more reporting that comes in, the red, so let's just stop right here, right? The red continues to fill in as more reporting comes in. And look, even as this uptick goes, we still don't know about it yet. But again, as the lagged reporting comes in, you can see how the truth is ultimately filled in. And by the time we hit the last day that a death is reported on July 31st, there's still a lot we don't know. And now we're into August, and the deaths keep coming in, coming in, coming in. And it's actually not until August 31st that we end up knowing all of these deaths that actually took place. So again, that simulation should have demonstrated a couple of things. So first of all, I want to just take a still photo of reporting through this dashed line. This is July 6th, right? So again, you see that characteristic downturn. Remember, the red would be the deaths by date of death curve, right? At this point, we don't yet know all of the deaths that are actually going to occur on July 6th or July 5th or 4th, right? We don't yet know about them because of this lagged reporting. All we know right now is on July 6th, maybe just one or two different deaths that were reported. But as we get more reporting that comes in, we will continue to fill this up until ultimately we know the total number of deaths that are going to occur. But again, we're always going to have more recently just because it takes time to learn about these deaths. It's always going to look as though deaths are decreasing in the most recent 2 weeks or so. Another example of this is, again, look at the curve that was in the South Florida Sun Sentinel's article. See the downturn here? Well, look at this. Again, what we know as of July 31st is this. So we would follow this trend, and then there's your characteristic downturn, right? Right here. But on July 31st, look at all of the deaths that we don't, the faded part here, right? Under the black line, but faded. These are all of the deaths that basically have taken place since July 10th that we really don't know about yet. And it won't be until August 31st, a full month later, that we know 99% of all of the deaths that will actually occur on these days. So that's your characteristic downturn. The leading edge of this curve will always turn down. And it's not because anything's trying to be hidden. It's because we just don't yet know about all of the deaths that are going to occur. So where this does become meaningful and problematic is if we're trying to now compare apples and oranges. We should not be, if let's say we're comparing states, one state's curve is based on the date that deaths are reported, the other one is based on the date that the deaths are actually occurring. Those are now pretty non-comparable curves, and so here's just a good example of that. These are the deaths reported to the CDC. Now, so if you were going to take that data set and you were going to compare Louisiana, Florida, Texas, and California on the deaths. These are 7-day moving averages, I think. No, 14-day moving averages, my apologies. And so notice that we know Louisiana is a hot spot. The reported deaths have been increasing. Texas, reported deaths have been increasing. California has been pretty consistent recently. And then Florida, though, you would think, well, they're definitely going up. But then what's this downturn all about? And again, you just have to know that right now, this is because it's a deaths by date that the death occurred curve, right? It's always going to turn down at the end. And so that's why whenever I'm looking at a curve like this, I will shade out the last at least 2 to 3 weeks and say, don't really interpret this. We don't know all of the deaths that are going to be reported in. So if we cut this off, we would still see that there is a recent increase, but we know that that increase is likely to rise. And so that's why you see now on my dashboard, I've got based on date deaths were reported, except for Florida, which is now based on when the deaths occurred. And so it just takes an understanding of where these data are coming from and just caution when you're comparing states to make sure that they're based on the same reporting. And this is not just specific to COVID-19 deaths. These are all-cause excess deaths. This is California, the entire United States, and Florida. And again, if you look at any recent time, they give you a caution, which is basically what I put up here. Excess deaths in recent weeks may be severely underestimated due to the death reporting lag, right? What is down here touching the zero line right here for California, it will go up. What Florida has here will go up. These numbers will go up. How much, we don't know, but there is a reporting lag. So again, it's not just specific to COVID-19 deaths. And the other really important thing to remember is Florida is not an outlier here, right? When the IHME, these modelers out of Washington State, estimated a great many things that I won't go into the detail about. I've got that in another video. They basically said that in the United States, they were guesstimating that the number of deaths that were actually due to COVID-19 was actually 58% higher than was being reported in the entire country. For Florida, it was 41% higher. So Florida was actually, in this case, 16th lowest among all states. Their degree of underreporting was not at an extreme. It wasn't the highest, it wasn't the lowest, it was middle of the pack. So this lag in reporting of deaths, it's not a problem in Florida alone. It's not a problem in the United States alone. It is a problem everywhere. When somebody dies of COVID-19, we don't know it immediately in the public health data systems that are capturing this. Sometimes the lag is very small, sometimes it's bigger, and there are different underlying reasons, but this is not unique to Florida. So again, I just thought this video would hopefully clarify a few issues about the death by date of death curve. Ultimately, like we started this by saying, ooh, one versus the other. To me, the message is give me both, right? Because both tell me some meaningful information. I get incredible accuracy in a deaths by date of death curve, but I always know that the most recent couple of weeks is underestimated. The date reported, I don't know a lot about from a week to week or a day to day basis. I don't know exactly where those deaths are coming from, but the general trends, if they're increasing or decreasing, can still be meaningful to what's happening with COVID-19 deaths. So, again, nothing nefarious is going on. The transition in reporting is something that I absolutely welcomed, and you can now use both of these pieces of information to get a very comprehensive picture of what's happening with COVID-19 deaths in Florida. And so that's my take home message. I hope everybody understands. I just really get frustrated when people jump to the conclusion that there's something intentional or misleading. If it was intentional, we wouldn't be able to still calculate the date reported. Like there's just, it's much ado about nothing. Again, I welcome it. I feel like I can do so many more meaningful analyses with a deaths by date of death curve that I can't always do with a deaths by date reported. So, as always, thank you for your attention. If you have any questions, please certainly let me know in the comments box. Take care.